The Dr. Fab Show, in association with BTL Vanquish Me.
Welcome back to part 2 of the Dr. Fab Show. Coming up, how to kiss goodbye to love handles, plus amazing carb-free spaghetti in the Dr. Fab kitchen. But first, we're with Dr. Martin Kinsella, qualified medical doctor, anti-aging specialist and dentist. I have a very special guest with me, Dr. Martin Kinsella, a medical doctor, aesthetic specialist and a dentist. So there's not much you don't do. But we've been speaking and you do some pretty innovative treatments at the practice. What would be something that our viewers would find really interesting?
A really popular treatment at the practice is the body jet.
What would that consist of?
It's got two main functions. Firstly, it's my preferred method of surgical fat removal, liposuction. It uses water, so that mechanically dislodges the fat, so it's very gentle, we get less swelling, we get less bruising, less downtime for the patient. And because it's gentle on the fat, it doesn't damage the fat cells, so we can then transfer the fat, or graft it, if you like, into different areas of the body.
In terms of, you were talking really sort of about, you know, laser resurfacing earlier on with me. What's something that different that you do at your practice you were mentioning with laser resurfacing?
We've got various forms of laser resurfacing, skin resurfacing in a general, but laser we have CO2, fractional CO2, we've got a couple of those, and then we have a slightly gentler one, which is also a resurfacing device, but using radio frequency. But the CO2 is the most effective.
What would be the indications for someone to think about or consider having like a CO2 laser?
It basically will treat all sort of most skin problems other than veins, so pigmentation, acne scarring, fine lines, pores, open pores, and it's the total package.
Dental is another big part of your business. What are some of the popular treatments that either celebrities or patients are having?
Well, I only practice cosmetic dentistry now, or aesthetic dentistry if you like, and I think we've seen cosmetic dentistry change from previously where it would be just people would want veneers, putting on quite drastic treatments. We're now doing aligning teeth or straightening teeth, and we've got different types of brace systems. Braces aren't just the train tracks that they used to have on for 2 years. They're now clear aligners that you can't see, or even ones that you can take out, and they can even take sort of weeks to a few months to treat. And veneers have slightly changed. We're seeing lots of people now who want composite veneers where it's added on, so it's less destructive to the natural teeth. So combination of straightening the teeth, composite veneers, bleaching, very popular. Great.
Well, I think that is a real insight into some of the most innovative treatments in the aesthetic industry. So thank you so much for that.
Thank you very much.
I'm here with Lauren, training manager at ProSkin Clinics, and we're going to be talking around the tattoo removal procedure, aren't we?
Yes.
So, what did Laura have done with her tattoo?
So Laura had a tattoo, I believe about 6 years ago, if I remember rightly, give or take. But she had it across the upper of her back. So it's something really that she's not liking any longer. So what we've decided to do is remove it for her. We're approximately 3 treatments in now, but Laura's had a fantastic result so far. She may need another 2, possibly even 3, it's hard to say, but certainly we're really chuffed with the results so far.
So just tell me a little bit more around the PicoSure technology that you're using for tattoo removal. So
technology or laser has been used for God knows how many years now for laser removal. However, it's been quite slow in its development. The PicoSure was released about 3 years ago. So it actually uses a much shorter burst of light, and what that will do is actually penetrate the area, break up the pigment much faster, but also into a smaller particle, so it means it's more readily absorbed by the body. So it means in comparison to older technology where you'd get, say, 15 plus treatments before you'd even come close to a removal.
How many is that?
It can be quite lengthy.
Wow, okay.
We're cutting that process down to, it could be as little as, say, even 4.
Now there's some pretty creative tattoos. I mean, one of our producers and directors on the show has got tattoos everywhere, and he's got lots of different colours. So what would you say in terms of how effective the PicoSure technology is with tattoos?
In comparison again to older technologies, it's actually really great on most pigments. The only one it's going to struggle with in particular will be red. However, there is a new handpiece that comes out in about a month's time. It's really, really great on your really stubborn blues and really stubborn greens, which normally, up until now, we've not actually been able to treat effectively.
So Laura, it's your turn to shine. So tell us a little bit about your experience with having the tattoo removal.
I mean, everything's been really professional, really great, to be honest. From start to finish, consultation is really thorough. I felt really well looked after, and I was really surprised at how quick the treatments are, to be honest.
Great. So how many treatments did you have, and how long does each session generally last for?
I've had 3 treatments so far. We're probably looking at another 2 or 3, and they literally last less than 5 minutes for the actual laser on the skin. So it's something that can be done in your lunch hour at work.
So our viewers are always worried about, is it going to hurt? Mm-hmm. Did it hurt?
Yes, but it's not to the point where it's not bearable. It's uncomfortable, but it's certainly not anything horrendous.
Great, okay, let's see the results.
Yeah, of course. So I'm just going to undo Laura's dress here. As you can see with the tattoo, it's a medium size as such, but the outline work, it varies in terms of its depth of penetration, but also the concentration of ink in the area. So you'll have some areas where you can see the ink is still quite prominent, whereas obviously some of the other line work is pretty much invisible now. The area did have a lot of shading through the entire tattoo, but now, or immediately after her first treatment, it had completely gone. So Laura, it was a great experience for Laura to be able to see it from the very start of her treatment and then immediately post to see the difference within it.
So Laura, final words about your treatment?
Really, really happy with the process. Hopefully 2 or 3 more treatments and it should be gone forever. So really, really happy.
So there you go. If you're interested in having your tattoo removed, then the PicoSure technology sounds pretty exciting. So visit ProSkin Clinics.
Hi, I'm Jack. I go to the gym regularly and keep myself fit. But I can't get rid of these love handles. What can I do?
Tracy, do you have any advice on treating love handles?
There's a fantastic treatment now that's been available in the UK for quite a considerable time, and it's called CoolSculpting. And CoolSculpting is a procedure where we literally freeze the fat, and it's a permanent solution to love handles. So for somebody who's wanting to reduce the muffin top, in fact it can be used in lots of other areas of the body as well. It can be used for bra fat, it can be used for inner thighs, outer thighs, it can even be used for male breast tissue, for moobs. But for love handles, it's a brilliant treatment. There's just an hour treatment each side, and the reduction of fat is very impressive indeed. And it's something that patients are asking for more and more at our clinic, because there's no downtime and there's no interference with one's lifestyle.
If you have a health problem and need some advice, then why not send us a video? Simply record the question on your phone and send it to us at the website on screen now.
Today I'm going to make a pasta dish using slim pasta spaghetti as opposed to our traditional wheat-based or egg-based pasta. The beauty about these pasta are they are 9 calories per 100 grams. I'll tell you more about the product as I go preparing the recipe. Today's recipe is white sauce mushroom with soy chicken. Now we get started. We'll make a roux. Let's just melt the butter quickly. So just a knob of butter in there. So there you go, butter sizzling away. Couple of, just a bit of white flour, plain flour. Milk in there. I think that should do. All right, we just make sure the consistency is pretty thick. There you go. That's good enough. Heat some olive oil. We'll add a shallot in there, just roughly chopped. Into our pan. There you go, sizzling away. And we'll prepare the pasta. The pasta comes in a clear a bag like that. Now it is in water, that's normal. We just need to drain them out. So we'll cut that open, drain it into a colander, just wash with running water and just squeeze the excess water out. And there you go. We'll just literally just throw them into our pan where we just want to heat the pasta up. While that's happening, we'll just add our mushrooms in there. Just roughly chop the mushroom up. And we'll add that mushroom with the pasta. So all the flavor, all the water which is released from the mushrooms are going to also cook and flavor the pasta up. Give it a stir, increase the heat if necessary. We'll add our mock chicken in there, a few pieces of mock chicken. These pasta are ideal for weight loss because they're only 9 calories. There's no carbohydrates in them, no sugar, no fat. They're perfect for diabetics because there is no carbohydrates in them, so no sugar, no spike in blood sugar. We can add a few sage leaves at this stage and it's pretty much ready to serve. Let's add our white sauce and just give it a turn and we'll be ready to plate. It's as easy as that. Literally a few minutes and you have a nice delicious pasta meal which will fill you up without the guilt. Look at that, that's perfect. It's all nicely done, nicely coated. Look at that. A bit of oregano on there. And there you go, that's our slim pasta fettuccine with white sauce, mushroom and soy chicken. Enjoy.
A while, yeah. My husband goes off to sleep like that and I'm like, half an hour or so.
Ooh, half an hour. I'll go to bed when I'm tired and it takes us less than 20 minutes to fall asleep.
20 minutes, half an hour.
As soon as I hit the pillow, I'm asleep.
5–10 minutes, yeah. Probably about that.
2 minutes and I'm asleep.
That depends on what day of the week it is, I think.
That's it for today's Dr. Fab. See you again soon.
The Dr. Fab Show in association with BTL Vanquish Me.